20 KDKA. This is Cars, Stars, and everything in between. He's the star, Richard Bazzi from Schultz Ford at schultzford.com. I am Bubba from 100.7 Star, and on with us today is Dr. Mark Sangimino. He is the director of the AHN Pediatric Orthopedic Institute and the AHN Division of Pediatric Orthopedic Surgery. Welcome to Cars, Stars, and everything in between. And I hope that's the only time I have to say all of that.
Thank you.
That's a lot.
I mean, when you read your resume, Dr. Sangimino, how do you have time to have a life?
Well, I can tell you, it's been a real honor to practice my whole career now, 30 years here in Wexford, and there's just lots to be done. So you find yourself with a lot of different titles, but at the end of the day, it's just an honor to take care of the kids in the community. And so my whole team here will say the same thing. We do a lot of different things, but just like you guys do. But at the end of the day, that's all we're really focused on. So we're just so happy that we can do it.
Well, that's one of the things, and because we are in the same community, and we talked earlier a little bit about, you did take care of one of my kids, Ariana, who I think had an ankle injury with our friend when she was playing softball for, I think, our mutual friend Vince Moriali.
Right.
He was a brutal coach.
Yeah.
But I remember that. So we do have some shared relationships, and everybody that I know that knows you said that's the one thing about you. You are all about the community. Everybody says the same thing. And that's one of the things that was really attractive to me when we talked about having you on as a guest, because there's some people that talk the talk, and there are some people that are actually part of the very fiber of the community, and you are. So I really appreciate everything you do and the availability you have for the whole community. But again, when I look at the resume, it's just mind-boggling. And I wonder, again, truly how you really have time for a life. But all the things you do, what's the most common? Like, do you see something more than anything else?
Well, every single day, every single week, I'm starting my office right after the show today. It's about a third is trauma in the community, things that hit your average normal kid that they don't expect. I did a surgery at 6 a.m. this morning on someone who fell off a trampoline, that sort of thing. About a third is routine growing kids with a surprise elective diagnosis. And about a third is kids with multiple different concerns. They have syndromes or cerebral palsy or something like that. So it's a good variety every single day. Probably the most common surgical things are the things like the trauma situations.
Dr. Sangimino, is there any one sport that you see more injuries than another in kids?
We are seeing, the category 3 sports like football, wrestling, gymnastics. We're seeing high volumes, just like every community does, and a good bit with horseback riding. But I think our profile, when we study these numbers, are very similar to most suburban areas. We also take care of the Pittsburgh itself, a little bit different demographics there, but it's the classic sports situations that we try so intensely to try to create prevention efforts to avoid injury.
So you mentioned one thing that you're addressing today, which was a trampoline injury. I have a pretty good friend whose daughter was pretty severely injured on a trampoline. And I just, when you look at it, and how much of that do you see from trampolines?
I know the whole impetus for this was when we did the program for car safety and animal safety. It's the same thing with trampolines. If you do it the right way, there are ways to safely exercise and use a trampoline effectively. But what so often happens in the excitement of the moment, they break the rules. 2 or 3 people on the trampoline, they start throwing balls. You take the safety features out, and it's really, a handful of trampoline injuries every weekend that can be very catastrophic. So, I think it's all about following the rules And it's so hard to do that with trampolines because they're in your backyard and everybody loves to jump on them. Next thing you know, they're out there doing things they shouldn't be doing. And it's hard for parents until you get a tragic injury to understand that they've got to stay focused on making sure those safety features are working.
I made an executive decision as a father that we had a trampoline in our side yard, and I'm not exaggerating. It made me so nervous that a windstorm blew it out of the ground and broke it. And I said, there was a reason. God sent us a message. We shouldn't have a trampoline. And I never allowed one again in my yard, no matter how much my kids begged. I just said no.
I bet that was hard. That was hard. Even this morning before I did this surgery, that little boy wants to go back onto his trampoline. They're just designed to want to do it. So it's so hard for parents. It's good that we help them understand to anticipate that.
I think I'm not sure I've ever heard anybody really say, it's all about the rules and staying within the lines of safety. And I never really heard anybody say that. And I think it makes perfect sense, to be able to lay out a plan and say, these are the rules on it and these aren't. Yeah, that's really cool. You just, again, when I look at everything that you do, my heavens, 1, 2, 3, 4, there's 40 things listed here. It's just unbelievable. You have a whole team and you are at AHN, right?
Right. Yeah. So this center, the Pediatric Orthopedic Institute, functions for training. So primary focus of my team every week is patient care, but a close second is training. We actually have high school programs for exposure to healthcare. Then I have a different format for early college kids, then a different one for early medical students. Then I'm one of the program directors for the residency, which is a 5-year surgical training. We also have fellowships. So we have all levels of learners coming through my center. Every day there's a format for hands-on learning, which starts with the basics of just taking good care of these kids.
Wow. So what ages, when you say children and children's orthopedics, what ages does that encompass?
So our specialty, when you become a pediatric orthopedic surgeon, you have to become a physician first, then a general orthopedic surgeon, and then do fellowship training. So that fellowship training is for growing kids. The key feature is growing kids. So we take care of, in essence, birth age 21 adults with special needs problems that they had as kids. But our real focus is the problems unique to kids that are growing up. They get unique patterns of injury. They need to be treated uniquely, and they need unique care to help them understand their injuries and help them cope with their injuries. So it's a unique skill set.
Is it unusual? My son grew 2.5 inches after he graduated from high school. So when he graduated from high school, he's about 5'10" and a half, and now he's almost 6'1". Is that unusual to have that type of growth spurt after high school?
It's within healthy parameters and range. It's not typical. But it can happen if your pediatrician was tracking the growth and his plates were open late. It's just really a combination of how God designs the bones and then their hormone profile. A late puberty can cause a late growth spurt. So we do see it. We see it commonly, and that also informs us as to what to watch out for and what preventive stuff to do as they go off to college. If their plates are still growing, their training has to be different if they're to achieve goals than kids that have stopped growing.
If you're just tuning in, this is Dr. Mark Sangimino from AHN. And this is Cars, Stars, and Everything in Between. More questions and more interesting conversation when we return on 100.1 FM, AM 1020, KDKA. We'll be right back.
Dr. Sangimino, is there anything in particular that you'd like us to make sure we talk about or ask you?
I'm open to anything. I thought this had something to do with that the sponsored Ford event where Garrett Rusnak threw out the first pitch, and we spent that day down at PNC Park about the importance of car safety for children and pet safety. But that wasn't my agenda, so I'm good with whatever it is that's open. Maybe that's all in the past and forgotten. That was just a sponsored event by Ford, which was really a wonderful opportunity for my patient to got spoiled for the day. He threw out the first pitch. Ford put him up in the box, his parents, his grandparents. And, and they also, you guys also featured, the neighborhood store featured the dog. So there was a dog there,
Yeah, it was a golden retriever. Yeah.
service dog. And that's what my wife does, trains labs too. So it was a great day.
Wait, time out. Your wife trains labs?
She trains labs. She does hunt training. She's an MD PhD that stopped working to take care of our 4 kids. And when they went off on their own, she started training labs. And now she's really connected to the hunt training and service and therapy training of labs.
Wow. So if I bought a golden retriever, is that in her wheelhouse?
Right. She does do golden retrievers. So there's a club, and most of the time she does standard labs, but the golden retrievers, there's huge representation there, and they're very similar, and they all do the same thing. They put them through this incredible hunt training, retriever training, and then from those talented animals, some of the people that do it for a real career can make a decision as to which one of those dogs are good for service, which ones are good for therapy, and that sort of thing. So the golden retrievers are beautiful. That's what we had there that day. Yes. When Resnick threw out that pitch. Yes. Was a beautiful golden retriever. And I'm forgetting the name of the guy who was close to the Ford team there. You guys knew him, and he brought their golden retriever, and it was beautiful.
Yeah, I don't remember that either. But okay, that's really cool to know.
That's what I thought the context was. But I there's so many hot topics right now in the community that we're getting from everybody. There's just so many things.
Why don't we lead with that, Richard? Why don't we lead with what are some of the hot topics in the community? Why don't we let that be our lead in? Okay, here we go.
Yeah, that's good.
Yeah, here we go. 100.1 FM, AM 1020, KDKA. This is Cars, Stars, and everything in between. Richard Bazzi, Schultz Ford, he's the star. I'm Bubba from 100.7 Star, and our guest today is Dr. Mark Sangimino with a big, long title when it comes to Pediatric Orthopedics, Allegheny Health Network. So, Dr. Sangimino, there seems to always be hot topics in your field. There's going to be a lot of them because you see more sports, you see kids doing multi-sports. What are some of the hot topics in your industry right now?
So there's many concerns. We interact every day with parents and grandparents, but one of the things that's coming up over time was something you'd expect. It's just parents concerned whether the intensity of their child's participation, whether the kids are properly prepared, whether why their kids are experiencing pain, why their kids are experiencing disability, and whether they're overdoing it. As we see a lot of pressure on parents to keep their kids in sports for a significant increased intensity, multiple sports all year round. So one of the things that's happening is we're seeing kids younger and younger with pain, and they come in and ask, well, should my child have pain? It's only 9, he's only 7. And the truth is that there are pain syndromes that arise very predictably from overuse that can be very concerning for parents. So we talk very frequently about ways they can avoid it by doing a series of things when they approach sports, flexibility training, the proper shoe wear, the proper approach to mechanics in sports, and also feeling in control that you need to put limitations. With that question you just asked about trampolines is the same thing. If we put rules around it and we follow the rules, we find very good outcomes. If we forget about the rules and we allow the emotion of the moment to take over, we find that kids have more pain, they have more disability. This concerns families. Thankfully, they're built strongly and mostly get over it, but we are seeing a higher incidence of catastrophic injuries. In 1 week, I had 4 under 10-year-olds throw out their elbow and needed surgical repair, like the classic Tommy John equivalent, 4 in 1 week. I mean, it just tells you something I didn't see 10 years ago or even 25 years ago.
Well, I got to tell you, Dr. Sangimino, I coach a lot of baseball. I coach a lot of on the high school level. I coach a summer team. I coach a high school baseball team. And I got to tell you, I'm going to say this as nicely as possible. Dad coaches that aren't experienced and don't understand arm care, because I'm fanatical about arm care for pitchers, and dad coaches that are having kids throw curveballs at the age of 10 should never be allowed to coach again. If you allow your 10-year-old to throw even one curveball, you should never coach baseball again. Have you seen a lot more increase in UCL surgeries in pitchers?
Yeah. So when I said blown out elbows, in a child, the anatomy dictates the pattern of injuries. So the kids don't blow out the UCL, they blow out their growth plate attached to the UCL. And that's what I meant. I did 4 of those in 1 week. And yes,
my God.
4 in 1 week. And you're exactly right, Bob. It's just like you're saying, it's usually because we're not following the rules, all with good intentions. They want their kids to throw. They're usually quite talented intrinsically. Some of the kids grow a little early and they're really strong and powerful throwers, but that you have to realize how God designed that elbow. They got powerful, big boy arm, but they have a little boy growth plates and they blow them out. And so it's a matter of setting appropriate age, appropriate rules, just like you're saying, no curveballs.
Amen.
And you're exactly right. It's and having the coach that has that knowledge leading the others and making sure everybody is aware that there's a coach that has the knowledge that you just expressed, that you need that person in control and in control of how you train, how often you throw, what your pitch count is, how, make sure if they're throwing with poor mechanics, you remedy that. If they're throwing pitches they shouldn't pitch, it's follow the rules and you get a better outcome. And that's usually the discipline of following those rules is what is kind of bridged.
Do you have any of the local sports programs that consult with you to help come up with those parameters and rules?
Yeah, so I've been part of this program over here my whole career for the last almost 30 years. And we're attached to 27 high schools. My partners take care of the Pirates. I take care of the Pirates kids. Soccer, professional soccer, rugby. So there's a lot. We have very common sports conferencing to talk about the rules, the standards, and I'm constantly challenging, what it looks like we're seeing in the literature and in our practice as to how we provide safety features. We have a few innovative programs that we've been focused on that might surprise you in terms of avoiding in the sports realm certain types of problems that are very predictable. And so the more we focus on it, the more our team comes up with things that are helpful. But it really boils down to those coaches wanting the input, being open to it, and mixing. But we have a good sports program at AHN. Very good.
Your partner. Who is your partner?
You mean Dr. Schneck, the other pediatric orthopedic surgeon, or you mean my other partners? Oh, my adult partners. We have 40 intramural partners. I started with a group of 5 of us. We have 40 intramural faculty now and another 40 extramural in the other hospital systems. And my chairman, Dr. Pat DeMeo, is a sports guy. He's a Pirates guy. And then we have all these different sports guys in the department. And I'm the director of the Pediatric Orthopedic Surgical Division, but there's a director of the sports division. Yeah. And we mix and mingle, and they send patients to me, and I send patients to them. So we have a rich discussion ongoing. We have grand rounds. We have training modules. All of us want the same thing. We want safe, effective participation without catastrophic injury. And we want to help these kids, become all God designed them to become without getting hurt.
Well, actually, Patrick is a really good friend of mine on a personal basis. So Patrick DeMeo is very, very good friend. And, what I see you guys doing is really unbelievable. There's nobody more pure in their intent than Patrick and to what you do. So I love the community involvement. And again, Patrick is a dear friend. And I will I didn't even realize we were doing this today, but I will call Patrick and tell him that we had a nice chat today. I can't wait to do that.
Yeah, I bet he'll appreciate that because he's really focused on all of the best things on the sports side, and he expects this division to act at that same spirit, to be protective and preventive and provide the best care we can.
Dr. Sangimino, do you see any sport that is trending up, meaning like lacrosse, for example? Do you see any sport where you're seeing a higher level of participation? Because traditionally, a higher level of participation means more potential injuries. Is there any sport that you're seeing in southwestern Pennsylvania that is trending up?
So a few sports number one, I would say gender-wise, what's clear to me is that girls are really trending up in their overuse. So in terms of gender in all areas, but in specific sports, we're seeing more hockey, which is interesting, more hockey-related injuries.
Oh, wow.
Although hockey's been a strong area of participation here. And we're seeing more lacrosse as well, but the classics still take up most of our time. Soccer, football, baseball, basketball, all your classic level 2 sports. And, we're seeing a lot of stress injuries, even in level 1, like runners cross country. I think across the board, intensity is the pandemic, I think, changed things. I think the body of some of the kids that went through that, they're just still adjusting, coming back.
Oh,
and
yeah.
some have too intensely come back. But in general, we're seeing most of the same trends just picking up steam.
Dr. Mark Sangimino from Allegheny Health Network, thank you so much for joining us for Cars, Stars, and everything in between. You are amazing.
Thank you for having me.
Mark, thank you